My name is Bob Ingala, and I'm the CEO of the Health Center. I'd like to welcome you to the Greater Lawrence Family Health Center. This week, as you may know, is National Health Center Week. And so we've been putting on this presentation now for a number of years. And we invite governmental leaders to this breakfast where we go through some of our programs, hopefully to educate you folks about some of the programs that we have in the community, the impact that we have, and to help exchange ideas about the direction of the health center and health care. So just to give you a little bit of background on the health center. Currently we have 540 employees. We're the 6th largest employer in Lawrence, although our span of service is actually within the entire Merrimack Valley. We have 20 service sites, including 14 homeless shelters throughout the Merrimack Valley, where we actually have our primary care physicians provide care to those folks at those sites. In addition, we have, as you can see, 100 doctors, nurses, and residents. And we have the unique position of being the only health center in the country that sponsors and operates its own residency program for family medicine. Over the last 10 years or so, or 9 years, the health center has grown significantly. We've increased capacity to care for patients by over 60%, and we've doubled the number of actual patient visits. As you can see, in 2001, we finished the fiscal year with about 101,000 patient visits, and in 2009, we were over 200,000 visits. So the demand for the services that we provide in the community is just incredible. It's just meeting that demand is a challenge just about every day. So as I said, we're the only health center in the country that operates its own residency program. And since its inception in 1993, we've graduated over 118 physicians who have gone mostly to other health centers like ours to provide care in underserved communities. 52% of those folks stay in Massachusetts, and 75% actually work in community health centers in underserved communities across the country. It actually has gained national recognition, and annually now we get in excess of 800 applications for 8 residency slots. This year we've actually expanded that, so we have 10 first-year residents. We have a total of 26 in the 3 years. Unfortunately, the residency is facing a financial crisis right now. Over the years, the Medicare funding for residency programs has been cut. And 2 years ago, the Commonwealth, because of its own fiscal crisis, decided to eliminate all funding for residency programs. And so that impacted us by reducing the funding by about $800,000, which has been sustained now over 2 years. Now the issue with that is the most residency programs are affiliated and embedded in large teaching hospitals. And so the funding that they receive from either the federal government or the state is really pretty low on the radar screen for them. It's diffused in ways. It's not, for us, since we operate and run the residency program and are responsible for all of the expenses, it's a direct hit. And it's very difficult to make up that kind of a shortfall when you have a program that should actually be expanding given healthcare reform everyone recognizes that there is a continued demand for more primary care, yet, you know, the funding for programs is going in the other direction. I'd like to actually turn the program over now to Dr. Joe Gravel. Joe is our Chief Medical Officer and also the Director of the Residency Program. So he has two very challenging jobs for the health center. In addition, Joe has just recently been installed as the President of the National Association of Family Medicine Residency Directors. So he actually has a national position, and he has a wealth of information on this subject. So,
Thanks.
Joe.
Thanks, Bob.